Hey everyone, welcome back to the channel. Today we're going to be breaking down what happens when you stop taking finasteride. Now, just sort of stepping back from it, finasteride works by inhibiting the 5-alpha reductase enzyme, being 5-AR. Now, this enzyme converts testosterone into DHT, or dihydrotestosterone. Now, finasteride primarily inhibits the type 2 and type 3 isoenzymes, and there's really quite minimal effect on type 1. Now, type 2 5-AR is the key isoenzyme involved in hair follicle miniaturization, and it's highly expressed in parts of the hair follicle and also the prostate. As a result of taking finasteride, prostatic DHT is reduced by over 90%, and serum DHT is reduced by approximately 70%. Now, increasing the dose does not actually meaningfully lower serum DHT that much further. The drug has pretty diminishing returns from 0.5 milligrams to 1 milligram, so patients often titrate their dose to try and limit any potential side effects. By comparison, dutasteride inhibits all three 5-AR isoenzymes, reducing serum DHT by almost 99%, a near complete inhibition. Now, in terms of clinical effects regarding androgenic alopecia, most patients demonstrate stabilizations and partial hair regrowth within sort of 6 to 12 months. However, the fact is that long-term adherence is required to ensure the efficacy of the drug. Hair loss progression is not overnight. It's a gradual accumulation that occurs over decades and perhaps years if you're unlucky and genetically predisposed to hair loss. If you imagine visible hair loss starting at, say, 10,000 hairs, that doesn't happen overnight. It's cumulative. Now, what actually happens when you stop taking finasteride? 5-alpha reductase activity returns to normal in about 1 to 2 weeks, and from there, DHT levels typically return to baseline within 2 to 4 weeks. When that happens, the genetic process of miniaturization simply resumes from where it left off. You don't typically catch up years of hair loss. There can be sort of a shedding phase as well, but it's more akin to how you sort of unpause your natural pattern of hair loss. If you imagine you're in a boat with a hole in it and the hole is slowly letting water in, being hair loss, finasteride in a way acts as a plug to slow the hair loss. Once you remove that plug, however, time has elapsed and the water still starts entering again. Finasteride doesn't cause physical dependence, so there's no withdrawal phase. When you stop, your hormone profile normalizes, and any side effects induced from the hormonal changes to your body, if you had them, typically resolve within weeks to months. Some men report issues such as low libido, fatigue, or brain fog, sometimes dubbed post-finasteride syndrome. However, controlled studies haven't confirmed a consistent biological cause. In most cases, these symptoms simply settle once hormone levels stabilize. We'll get into that in another video, but the nocebo effect is very powerful and should not be discredited in these situations. Now, in terms of timeline, here's a typical timeline post-discontinuation of finasteride. Week 1 to 2, DHT rebounds to normal. Now, months 1 to 3, your hormones balance out, side effects resolve again, and then from months 3 to 6, hair that was maintained starts thinning again. That's the reality of the situation if you discontinue the drug. It's a lifetime commitment if you're on finasteride. Now, hair loss timing is, of course, dependent on if you're taking minoxidil or other DHT blockers. I've got plenty of other videos that deep dive into the mechanics of finasteride, so please check that out. Now, I guess the key takeaway is that finasteride doesn't effectively cure hair loss. It manages it by suppressing DHT and requires adherence to the medication. When you stop, DHT returns to normal and your genetics take back control. There's no crash, no rebound. You just return to baseline. If you do stop, do it intentionally. Maybe taper into a topical formula or maintain minoxidil coverage. And as always, talk to your doctor before making changes. Hope you guys enjoy the video. Sorry for not posting last year at all. And subscribe for more evidence-based breakdowns. Thanks for watching.